Hey guys, my name is Vinod and my blog is medschooleasy.wordpress.com. And today I wanted to talk to you guys about the differences between the MD degree, the MD PhD degree, and the PhD degree, and sort of give a brief and surface level overview to demystify some of the more subtler points about these different degrees and which path you should pursue if you're interested in the sciences. So, I'll give a brief overview of each degree and sort of what that involves and what the career paths are, and then I'll sort of wrap it up at the end with a direct comparison. So to start with, an MD degree is a four-year program. You apply to these MD programs and you basically follow a path where you do your medical school, then you go to residency, and then you practice. You can join a private practice. You can do clinical research in an academic center. So by clinical research, I mean that, while you are treating your patients on one side, you can also do a lot of chart review and look at your past patients and look for trends and sort of publish papers based on your experiences with certain treatments. You could also, as an MD, be involved with clinical trials. And you could sort of get FDA approvals for a certain new technology, and you could try it out. You could even partner up with some guy who's more of a basic scientist, like a PhD, and you could serve as the person who applies their technology to actually treating patients. So you're basically the envoy to the patients. You sort of bridge that gap, and so that's really cool. And as an MD, it is a four-year program, but if you want, it's becoming an increasingly prevalent trend to take a year off in the middle of the MD program, a gap year, if you will, to do research and to become more familiar with either clinical research or with basic science research. So that's sort of like an intermediary path that people are starting to do now. So that's the MD program. Now let me shift gears to the PhD. So this is the pure PhD track. So the PhD is generally, I've heard, crazy stories about people finishing it earlier or later, but generally I think 5 to 7 years is the common range for how long it takes to complete a PhD. The limiting factor being how fast you are to run experiments and publish papers and have basically at the end of your PhD, the way you graduate is you have to defend your thesis. I'm not done a PhD, so I can't go to the details, speak to the details, but you basically have to present your research to a panel of researchers and get their approval. So it's a 5 to 7 year-ish program. You're doing basic science research. So basic science is basically bench work. So you're actually running experiments on like animals. You are, and it may not involve animals, but it's basically bench work. As opposed to the clinical research I mentioned earlier, which is more of doing retrospective patient reviews of data that you've stored on your computer. So it's computer work versus this is more bench work. And PhDs either stay in academia. That's one path. So you can become a professor. You can teach. You can continue your research as a PI and have your own lab and get funding from the government and have your own students. Or there are people who also use it as a way to transition into consulting or to transition into a finance career of some sort. Basically, it's an advanced degree and it shows that you have a certain specific subset of knowledge. So that's a brief overview of the PhD. Now, if we turn to the MD PhD or the MSTP program, MSTP basically refers to an MD PhD who has formally applied to a combined program versus someone who's doing an MD PhD, which is essentially the same thing except that you've applied to the program separately. Anyway, those two can basically be lumped together as you are getting an MD and a PhD. And essentially this track is, I've heard it's about 7 years, maybe shorter in some cases. You basically do, and it varies, like the specific structure varies, but I've heard of places doing 2 years. So you'll go to med school for 2 years, take your step one exam and then basically go into a research lab for a few years before you return to finish your third and fourth year training, which is the clinical rotations in the third and fourth year of medical school. So you're basically taking a gap in between medical school of, let's say, 2 to 3 to 4 years to do basic science research. And the MD PhD is useful for people who are looking to have patient interaction and also have the research going on the side. And in comparison to an MD doing research, an MD doing research would probably spend, like, let's say 60 to 80% of his time treating patients and maybe a small subset of time, like 20% of his time doing research. The MD PhD will essentially spend maybe 60 to 80% of his time doing research and maybe 20 to 30% of his time seeing patients. So it's kind of flipped in the opposite vein. And MD PhD is generally, and obviously you can go into whatever specialty you want as an MD PhD, but generally people who are passionate about doing research will go into a field like psychiatry or neurology or anesthesia, basically fields that are largely unknown to us and have a lot of potential for research, basic science research, such as neurology. We don't know much about the brain compared to its function and what we could know. And not only will the field have a great depth of knowledge that is capable of being investigated, but it will also give you the time to do research on the side. So let's contrast a field like psychiatry with a very intense surgery residency and career. In a psychiatry field, you would have time in the evenings, for example, that you could do research being a resident or being an attending, whereas in a surgery field, like let's say neurosurgery, you're probably going to be working from 7 a.m. to 8 p.m. hardcore in the clinic. So where is the time to do research? Especially if you have a family, there's not much time to do basic science research, which is actually going to lab and doing experiments, running experiments. So MD PhDs, coming back to my point, spend more time in the research lab compared to their practice, generally speaking. Of course, there are exceptions, and they will choose a career track residency that is more forgiving to that research interest or allows them to spend more time doing research. So tying all these three together, what I think the real question that a lot of people have is, which should I go into and which is the best to do? And that is a very personal question, and I would say that there's a lot of advice out there telling you what you should do and what you shouldn't do, but I think that it ultimately comes down to taking a step back and saying, okay, where do I see myself in 20 or 30 years? And if you see yourself as someone who is like a hardcore surgeon who is like seeing patients all the time and doing surgeries all the time, then perhaps the MD is a better idea. And to at least go with that at first and then later think about something else. If you're a type of person who says, hey, I like the research, but seeing patients is cool too, and maybe that's something I would want to do split 50-50 or something of that nature, then the MD PhD makes sense. If you want to become a hardcore academic guy or girl and you just want to become a big time professor with lots of grants, lots of funding, and you want to have the opportunity to have students and have that type of lifestyle as a very prestigious individual in a university, then the PhD route would afford you those capabilities and would get you there. So it's really a personal question of what you want to do. Where do you see yourself in 20 to 30 years? And that will really help guide you guys backwards to figure out, what do I need to do to get there? So this is my brief overview of what I've understood about MD versus PhD versus MD PhD. I hope you guys have enjoyed it. Again, my blog is medschoolEasy.wordpress.com. If you have any comments or questions, feel free to email me or leave a comment down below. Thanks, guys. I'll see you later.